The word stress is one to where, I don't know, it's probably one of the more relevant buckets, but I don't like it because we're so used to just like thinking that it's something that's bad, but we have no control over. We can't change all the difficult circumstances we face. We can't make life be effortless, and of course not. But the adrenal glands govern a lot of things. They govern our circadian rhythms, how we regulate our blood sugar, our light exposure affects them. So even though we can't make life effortless and smooth, we can do some basic stuff to make our bodies more resilient and not just get mowed down by all of it.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. Are you experiencing any of the following? Anxiety, irritability, nervousness, difficulty sleeping, challenges with your weight, muscle weakness, irregular, frequent, or heavy periods, temperature sensitivities, vision problems or eye irritation, fatigue, forgetfulness, hair loss, skin challenges? No, this is not an ad listing off a bunch of side effects of a medication. These and many other symptoms are signs of thyroid disease. 1 in 8 women will develop thyroid problems during her lifetime. However, it's often missed when it could be caught and addressed early. So I asked today's guest to come on to do a deep dive on thyroid. Dr. Christianson is a naturopathic endocrinologist with a focus on thyroid disease. He has been actively seeing patients since 1996 and is a New York Times bestselling author of the Metabolism Reset Diet and the Thyroid Reset Diet. Dr. Christianson is the founding president of the Endocrine Association of Naturopathic Physicians and is the founding co-president of the American College of Thyroidology. You may have seen him on national TV shows like Dr. Oz, The Doctors, The Today Show, CNN, or print media like Shape Magazine or Natural Health. Today, we discuss what women particularly need to know about their thyroid, how our thyroid may change during transitions in our life, what symptoms to look for, when and what tests to ask your doctor about, and medications, synthetic versus natural, when each should be considered. This and much more on today's episode of the Woman's Doctor podcast. Everyone, I want to introduce you to Dr. Christianson. So great to have you, to be able to include you in this docu-series. For those you don't know, Dr. Christianson, he is a naturopathic physician, one of my colleagues, and he also is a New York Times bestselling author of the Metabolism Reset Diet and the Thyroid Reset Diet. And so I'm excited to dive into the thyroid, deep dive into thyroid today, and how our thyroid as women, what we really need to pay attention to.
Yeah, all good. Thanks for having me, Dr. Trevor. This will be a lot of fun.
Yeah, absolutely.
So hang out with my bud for a little bit here. This is cool.
I know. It's great to catch up, even if it's on Zoom. So let's talk about thyroid and women's health. And it is a bigger deal than I think a lot of women realize. And so what are some of the things that women in particular need to think about with thyroid?
Yeah, great question. Well, thyroid disease is on the rise, and there's a lot of versions of it. The gland might not make the right amount of hormone. The gland might get attacked by the immune system. The gland might get cancerous. And we now know that thyroid cancer is the most rapidly increasing type of cancer amongst women. And also then thyroid disease being one of the biggest unexplained causes of chronic symptoms. And this is a disease that's somewhere between 6 to 10 times more common in women than men. And it comes on in adulthood. So this is very relevant.
Yeah, absolutely. And so I know that there are also certain phases and stages of a woman's life where she might be more susceptible, like pregnancy. Can we talk about that time in our lives, first of all?
For sure. And even one of the reasons why this is more relevant to women in general, the thyroid hormones are so crazy powerful. They're like the body's main switch for go or stop and wherever in between. And there's a lot of things that interact with them intentionally, so they can be fine-tuned really well. And the hormone estrogen, it has an effect upon a protein that slows down thyroid hormones. So as estrogen changes, thyroid levels have to change as well. And if the thyroid gland is getting by, but it doesn't have a whole lot of leeway to adapt, that's the time where it starts to really show its problems. So pregnancy is a big one. This is when the hormone levels are highest than they are at any point in life. And that's kind of like, swimming in molasses as far as thyroid hormones go. So if your thyroid's healthy and it can keep up, that's great. But if your thyroid's functioning at 50%, you might not know otherwise. But once the hormones of pregnancy come in, that's when it can really show up.
What are some of the signs then that thyroid might not be functioning at full capacity?
And this is another big enigma. There's some of them that are rather specific, like the gland can enlarge, or someone can have like changes to their voice, or they can't swallow very well. But a lot of the symptoms are the ones that people are often used to just chalking up to whatever. I'm a few years older. It's been a busy last few weeks. I'm not at my best. There's a lot of these vague things that we're often used to like just ignoring and, kicking the can down the road, and maybe this will get better soon. And a lot of those can tie into the thyroid function. So yeah, those extra pounds. A lot of people have a sense of like, here's what I can get by on with my diet and my exercise, and it'll get me reasonable results. But then that equation can change. So that's a big clue the thyroid could be switching. And then repair of the body's connective tissues. So how well we repair skin, hair, nails, tendons, ligaments, those things also. There's a balance between how quickly those things normally wear out to make room for new healthy cells and how quickly those new healthy cells grow. And if the thyroid's not working right, that balance can change. And suddenly a normal rate of wear out can lead to loss of healthy tissues. So yeah, unexplained weight, poor connective tissues. And then along with the weight, energy levels go hand in hand. Your body weight is a function of how well you're burning fuel. And if you're not burning fuel well, it builds up in a stored form as fat, but then also not burning fuel well. Your mind and your body are too tired. So those are the real big three things that point toward that.
Yeah, absolutely. And those are such common things that women experience throughout their lives. And so I don't know about you, I would imagine, but in my practice, just about every woman that comes in to see me, I'm going to do a thyroid panel because it's good to catch it early as well. So what do you say about lab testing and what women should ask their doctors for?
Yeah, it's a tricky thing. So you want to be screened first and foremost. You want to make sure that that's part of the doctor's thought process. Whenever you're not feeling well, your thyroid hormones affect literally every cell from head to toe. So there's no symptom they can't have some relation to. And Dr. Trevor's right. They should always be taken into account. So that's the first step. Is it even on the radar? Is it even being screened or thought about? And that's the first box to check off. The next thing to think through is that when it doesn't work, almost always the reason is because the immune system is attacking it. So there's this long, gradual immune attack that can go on for decades before the gland like totally shuts itself off. If the doctor is checking it and the gland has shut itself off, that's going to show up. But the data is clear that you can be symptomatic in that transition timeframe where it's not shut off, but your body's still going after it. So the doctor should also screen for the earlier signs of autoimmunity. And that's, thyroid antibody panels. So that's the second consideration. Are they looking for autoimmunity? And the last thing is, do they have some sense about how thyroid function looks in healthy people? How it is in normal lab values is simply a statistical artifact of average levels for everyone that gets tested. And people that get tested, most of them already have thyroid disease, and they're being monitored to see if their medications are working. And even further than that, those who can't stay stabilized, they get tested the most often. So they contribute the most to average levels. And they're just by definition not reflective of healthy function. So yeah, the first off, the doctor's got to think about it. They've got to screen for the earlier signs of the disease. And they've got to have some sense about, not just are you in the ballpark of everybody else, but are you healthy? Is it really working well?
Yeah, so let's talk about those labs that you typically run. That you do free T3, free T4, TSH, thyroid antibodies, any other labs that you suggest?
There's a lot of thyroid labs, and if someone gets nerdy about this, they can find lists that get longer and longer. And in some sense, it's almost like, I don't know, experts make it like a badge of pride if I check 50 things or I check 53 things. But more data, you need some, but there's a point at where extra data doesn't really give extra clarity. So the earliest things to change with the process of thyroid disease, most commonly the first one's going to be the onset of thyroid antibodies as the first step. Now, the weird thing is that there are many people that have autoimmune thyroid disease that will not have measurable thyroid antibodies. So if it's not there, that doesn't rule it out. But if it is there, it does show it. And that's often the first sign. Typically, the second sign is the brain starts just yelling at your thyroid. So the process is that your brain tells it to work, and it works, and it makes these hormones. Now, the hormones that it makes, because it's life or death to keep them right, even if your thyroid's working its butt off to function, those hormones stay stable until the last moment in which they cannot. So free T and T4, they're good to measure, but they're not early indicators because your body holds them up even when it's working really hard to do so. So it's only where you can't hold them up for another minute, then they collapse. But that's like the latest step. That's like the last thing. So it's good to have them on there. But the earliest things to change are going to be the antibodies show up and the TSH moves outside of a healthy range. And one brief point to throw in is that there's a big difference between your thyroid levels are not ideal and not healthy, and you can now benefit from thyroid medication. And that's a glitch I see in a lot of our natural medicine world, is that we can identify that it's not right and it's not ideal, but that doesn't mean medications are necessarily going to help. So the cool thing is that your lifestyle and your diet can make a big difference for this.
Yeah, absolutely. And I think it's great. Thank you for going over the labs and talking about that. And of course, we always want to look at labs in relationship to a patient's symptoms. You don't want to just look at symptoms, and you don't want to just look at labs. It's important to look at both, right?
Great point. Great point.
Yes. And so does it match up? And if not, like, let's just maybe test again and maybe throw in some more tests and see what's going on. And I do want to remind people there's more than one type of thyroid antibody test. I've seen doctors just run one and not both, right? Don't you think it's important?
If anybody wants a detail, we've got thyroid peroxidase, antithyroglobulin. There's a few others as well. There's thyroid stimulating immunoglobulins and thyroid receptor antibodies and thyroid receptor blocking antibodies. That's the spectrum. Yeah. But in most cases, an antibody panel will include what's the thyroid peroxidase or TPO and antithyroglobulin or anti-TG. And somewhere around half to 80% of people with autoimmune thyroid disease have that TPO show up. Somewhere around 20 to 40% have that anti-TG show up. So if they're there, they are signs that there's an early assault against the thyroid.
Yeah. Okay, great. So, and people can get those tests with their doctor, and then they just want to keep testing, right? And that you don't just test once, that you can continue to test to make sure you're moving in the right direction with treatment, right?
As a great point onto that is that any one result can be a little misleading. So if something seems really unusual, it can be worth just looking at it again in a few months, taking reasonable steps and seeing if that was part of a trend or if it was just a fluke.
Yeah, absolutely. Because it does happen. Sometimes labs just kind of look unusual. Okay, great. And then you mentioned the timing of treatment, that sometimes there's a lot we can do to support the health and the thyroid overall before just jumping to medication.
Yeah. So this is something that's really been, kind of bubbling up in me. We understand that healthy people have healthy levels of hormones. And we're often quick to assume in natural medicine that if we can make those hormone levels look healthy, that we will now create healthy people. And it may not always be the case. It's almost like, if your car is sputtering, and let's say you got an old car where the gas gauge is a dial, and you could reach in and like crank that dial to F. You're not going to be able to drive any further because of that. So when someone does start to develop thyroid levels that are not optimal, that totally does correlate with a lot of symptoms like we've mentioned. It can correlate with various disease risks. It can correlate with other health problems. But that doesn't necessarily mean that making those levels look normal via medication will solve all those problems. It seems like it could. It seems like a logical assumption. And there are definitely circumstances in which the medications are necessary and life-saving. But by far the most common scenarios, the data is strong that the reasons that about 80 to 90% of people go on thyroid medication are reasons in which thyroid medications are doomed to fail. They will not help symptoms. They will not lower the risk of disease progression. They won't cut the risk of related diseases. They won't cause weight loss or well-being. There's strong evidence about that. But we can talk about, we do know that diet and lifestyle can help. And not just help in terms of changing the numbers, but really hitting those causative factors that cause those numbers and therefore help the symptoms as well.
Okay, great. Well, let's maybe we could just give some examples of what people can do. So say you have a woman that comes in and she's experiencing some fatigue and maybe like, dryness with their skin, some of the typical thyroid symptoms. So she might have some constipation. She's got some weight gain and you run a panel and she's got her TSH is high. So meaning that she's got low thyroid function. And so what would you say where would you start with someone like this? Maybe she doesn't have the thyroid antibodies, but just low thyroid, hypothyroid.
Sure. We could even throw in the antibodies if you want. And here's a pretty big study.
Add that layer on in a second.
Let's make this example scenario good and sick. So let's make it a challenging case. Okay. So here was a clinical trial. They took a group of people that had had thyroid disease for about 4 years. And if anyone's listening understands these numbers, their TSH scores averaged 14. So they were well outside the normal range. This was to where any doctor anywhere that had their glasses on would say that's a problem. Like no dispute, like clearly a problem. And they were symptomatic, weight gain, like you mentioned, the hair and skin problems, the fatigue. These people were really suffering. And furthermore, they had been looked at their prior labs the last few years. This wasn't a fluke. They had been pretty steadily at this state. So for the following 3 months, they did one single dietary change on these people. And 78.3% of them at the end of it had completely normal thyroid function. Now, 70.3 is a good number. That's a lot. I would take that. But it was even better than that because, people are people. Not everyone followed the guidelines very well. So of those that didn't respond, a lot of them, like the lottery, you got to play to win. So a lot of them didn't play. But if you look at those, and the other thing is that many people were much, much more sick than that. And some of them improved a lot, but they didn't get put in that bucket of the 78.3% because they didn't get all the way back to normal yet. So now if we redefine that and say, okay, so of those who did play, of those who did really follow the guidelines, how many either got totally better or had a radical improvement? That number was 97%. So yeah, we have control over this.
So what was the dietary change?
Well, so thyroid disease, there's 3 things that drive it, 2 of which we can't do much of anything about, and that's going to be age and gender, those first 2. The third one group of researchers said that of the hundreds of factors known to be associated with thyroid function, that by far the most relevant one was iodine. And not only that, they argued that it was not only the most relevant, but it was more relevant than all those other causes combined. And then the last wrinkle on it is that we can think about things that give rise to a disease, but we've got a saying about, the horse is already out of the barn. The problem's already started. You can't fix it. So some causes are too late to help. If you identify a cause, that's not always a cause that by addressing that cause may not change things. But this is one that does. This is one that's been shown to be a real clear causal factor and also to reverse the disease process for many people.
Wow. Okay. So iodine. And so where do people get that?
Yeah, a lot of sources, medications, supplements, topical products, some of them have that. And then also dietary factors. And it's such a crazy paradox. So many nutrients that we know about, we need them. We often get too little. We're really not in danger of getting too much. That's the case for pretty much any nutrient you can think of. None of that's true for iodine. We do need it, but we can very easily get too much. Everyone needs about the same amounts, but not everyone tolerates the same amounts. There's a big difference in how well we can deal with a slight excess. And those who are susceptible to thyroid disease, they're the ones that just can't deal with that slight excess.
Interesting. And so what is sort of the range then? Is there a range that is kind of across the board, or does it really depend on the individual?
Well, if we're talking about adults and we talk about requirements for starters, there's not a large variance with that. That's somewhere between like 50 to 100 micrograms per day for all sources for adults. And we've got so much data on this from all the nations that have added iodine to their foods and watched how thyroid disease plays out. So that's a pretty big range. Now, that's requirements. So tolerance, in terms of how much you can safely tolerate, those who are not susceptible to thyroid disease, they can probably do fine on about 1,100 micrograms per day. So somewhere around 5-6 times that upper limit of the requirement. But those who are susceptible to thyroid disease, their tolerance is the same as their requirement. So anything they get above 200 micrograms per day can be a stressor on them and can drive the disease process.
Yeah.
And that's bizarre. I mean, vitamin C, we need just a speck to not get scurvy. And we can take a speck times 10,000 and be safe with it.
Right.
But
Right.
iodine's not like that.
No. And I know a lot of times people think, oh, if a little bit's good, then more is going to
Right.
be better. But certainly
Right.
not the case with iodine. What are some other, thank you for sharing that. What are some other nutrients that are really important for the thyroid?
Well, pretty much all have some relevance. The second most relevant one would be selenium. And there's no data saying that a lack of selenium causes thyroid disease. But what happens is that if someone's low in selenium, their iodine tolerance window is even narrower. Then they've got even less leeway than they would have otherwise. So we need selenium for all these relevant reactions. Next up, big one would be iron. And there's many ways by which we make some of these key proteins and enzymes that involve iron. And also the way we make use of thyroid hormones depend upon iron. And this is so important for menstruating women. So many of them are chronically below ideal in iron. And what's been shown is that what's ideal is different if someone's thyroid function is off. So most could do fine on their iron levels being here, but if their thyroid's marginal, it's a tighter, narrower range. So even if you're a speck, not even below range, not even in range, but if you're a speck below a certain window on your iron stores, that will really compound thyroid issues.
Yeah, that's interesting because a lot of women do end up with iron deficiency anemia. Is one of the most common nutritional deficiencies in women, right?
Mm-hmm.
So, and women can get their levels tested, right?
Mm-hmm.
Yeah.
Yeah, there's a lot of ways you can look at that, but just to give a sense of the magnitude of the problem, ferritin is one of the measurements that shows iron in storage. And most labs would say that's normal down to about 10 nanograms per mil. But there's published clear data saying that if a woman has thyroid disease, she may be symptomatic in terms of fatigue or hair thinning if her ferritin gets down even below like 90 or 80 nanograms per mil. So it really does influence health in many ways.
Right. And two of the symptoms of low thyroid function are also signs of low iron, right?
Totally.
Like loss and fatigue. So
Not a coincidence.
Go hand in hand.
Yep.
Yeah. Okay. Awesome. So these are all really important nutrients. What about herbs or other natural substances that can be helpful for treating thyroid?
Yeah, there's many things that can help elements of thyroid disease for sure. I mentioned selenium, a lot of data about the relevance of inositol, some good papers on a plant called nigella or black cumin. Those both have been shown to lower the autoimmune process and also help to mitigate many of the symptoms of thyroid disease. Nigella is a cool thing. It was used as a cooking oil for millennia in the Middle East, and it's a great general anti-inflammatory. It's one of those things that stains. It's a polyphenol-rich, highly pigmented plant food.
Okay, amazing. And so, but we do know that there are thyroid medications. You mentioned a lot of times we're too quick to jump to that, but they are really powerful in helping a lot of women with their symptoms and helping support their thyroid. So, what do you think as far as medications go? There's of course compounded thyroid medication. There's things like Armour and Nature Thyroid. And then there's more of the Cytomel, Synthroid, the more synthetic pharmaceutical. What do you find as far as the range of these?
Yeah, so for the first thought I always have is if someone needed them in the first place. And there's been a lot of papers about the idea of de-prescribing. We now know that 80-90% of people never needed them in the first place, and the medications may be counterproductive or just not effective. But many do. Many benefit, and for many they are necessary. So you outline some big broad categories. We think about the synthetics and the natural compounds. And this is kind of weird. You've got some speakers that are talking about natural hormones like estrogen, testosterone, things like that. We don't use our nomenclature consistently between thyroid and estrogen or testosterone. So in that world, what we call natural means chemically identical to what the body makes. And that's a good benchmark. You want something that's not, you don't want to put kerosene in a gasoline automobile. You want the right molecule. But in the thyroid space, we raise a higher bar. And I don't know if it's always a realistic, necessary distinction. So there, what we call synthetic are hormones that are made in a laboratory. They're chemically identical, they're bioidentical, but they're not plucked from a natural source. We happen to have hormones that are plucked from natural sources. They're taken from freeze-dried pig thyroid. So yeah, in this world, synthetic means just synthesized, even though they're bioidentical. And then natural means plucked from a pig, which is not the same as how it's used in the other world. As a generalization, the mainstay of therapy is synthetic T4. And the thought process is the thyroid mostly makes T4. The body makes other hormones out of T4, T3 and T2. And for many, many people, that works well enough. But there's just clear evidence that a lot of folks with thyroid disease don't do all that making out of stuff well enough. And sometimes not only that, but a lot of one hormone, when there's a relative deficit of the others, may cause more symptoms than just that deficit of the others. So a good subset of people do better in what's called combination therapy. And natural thyroid I like a lot because that's the one combination form that includes the three biologically active thyroid hormones, T4, T3, and T2. They do make synthetic T4 and synthetic T3, and they can be used, they can be combined in compounded forms, they can be used in separate versions. Also, a way in which thyroid and other hormones are different is that we're talking about a whole different quantity of mass. So they're a lot smaller amounts. So compounding can work really reasonably well for milligrams and hundreds of milligrams. But a lot of thyroid specialists get a little concerned about it when we're talking about micrograms. You're basically making a batch of muffins and hoping they all get the same number of blueberries. Or worse yet, hoping they all get the same number of poppy seeds. If you got poppy seed muffins, it wouldn't happen. So many of us are concerned about compounded medicines because they don't always have ways in which they're tested after they're formulated to be sure they've got what they're supposed to have. They can be done well, and there are some pharmacies do a good job of that. But if we don't know more details about the pharmacy, many do like pre-made medicines. And yeah, synthetic T4 only can work well for some, natural can work for many. One brief thing, T3 can work well with T4, but doesn't work as well as a standalone therapy. It's sometimes done, but there are some safety concerns about that.
Yeah, absolutely. So I know people probably, especially those that have been struggling with their thyroid for a while, are familiar with T3 and T4, but there are probably fewer people that know what T2 is. So
Yeah.
can you talk about that?
When I was little, one of my favorite books was Dr. Seuss's Way Beyond Zebra. They had all these bizarre letters that this one kid made up. And so, yeah, you hear about T3 and T4, but there's a whole lot of other things in the zoo. The category is called thyroamines. And we know of about actually 2-3 dozen biologically active thyroid proteins. So of them, T2 is probably the best documented one. The 4, 3, and 2, there's a protein called thyroglobulin, and that has a template that holds on to iodine atoms. So one template with 4 iodines is T4, and 3 of them is T3 and 2 of them is T2, so it's that simple. But there's other forms in terms of where the iodine fits, how the protein is shaped, and they all have some level of activity. They don't all register the same way in the blood tests, however. So the one argument for natural thyroid is kind of a conceptual argument that this is the closest replication of the body's own function because of all this big, long list of active versions of thyroid hormone.
Yeah. And thank you for explaining that. To every patient that's come in to see me, it's different. They're all so different. Sometimes there are some patients that I found did better on synthetics than natural.
Sure.
Usually I could find, not a nice combination of the natural thyroid that worked for my patients. And then some patients didn't tolerate the synthetic at all. And so they come in to see me because is there anything else I can do? Or they were only put on T4, but yet, T3, we looked at their numbers. So,
Sure.
and then once they start to change their thyroid medication, we're just having to monitor and see how they change. And then they go through a pregnancy or they go through menopause. And then it's like, okay, we need to change it again.
Starting over.
So how about you with your practice? Is that what you found as well, that you just have to kind of make changes and individualize and really pay attention?
Really high level ideas from just focusing on this and training doctors in this for the last quarter century. I used to think a lot about the exact numbers being the solution. And more, I think that, most people, it's a difficult process because they never needed it in the first place. So the first question I ask is, did you even need this? Was this something you really had to have? Because if you don't, adding that medicine in, it makes things goofy. They don't feel well. And you think it's because it's not right or because it's a lack, but it might be because just they never even needed it. So that's the first question I ask. The next one I think about is really their iodine status. Are they getting, it's almost never an issue getting enough, but avoiding the excesses. Once that happens, the body has so much more leeway to do its own regulation of thyroid hormones. And that's the thing, healthy people have a certain spread of thyroid function. It's not always right there. They will deviate, but it doesn't really affect them. So I think less and less about how do we dial in those numbers perfectly and how do we give someone back their resilience? How do we make it to where they can have normal function, normal fluctuations, and not have that affect them? And then the last thing I think about is, what are the other conditions? So someone that has thyroid disease, there's about 15 completely different, very real medical phenomena that they commonly have, one of which 84% or more of them have, many of which it's a matter of 20 to 40%. And then there's 15 of these. So almost everybody that has thyroid disease has a couple of other problems, and most have not been identified. We think about things like atrophic gastritis or celiac disease or hyperparathyroidism or latent iron depletions, like we mentioned, sleep apnea. But there are these real things that affect a lot of people. So I've stopped thinking about the answer always being the perfect dose, but really what else is wrong? So just, do they need the medicine? If so, then let's get it right. But if not, let's get it out. And are they getting interfered with from the iodine? And is there something other affecting their symptoms? But that's how I think about it the most nowadays.
Yeah. And, I think what I think is important is to really work with someone who's well-trained. And I know you train doctors, so this is, and help them really dial this in. So that's fantastic. But it is so important, I think, for people to work with someone that can monitor them, can watch their symptoms and watch their lab work and know when to test and when to change, when to do the medications and other supportive things, rather than just I think a lot of people try and do it themselves, or they just go in once. Sure. And then they're, I'm not feeling 100%. Well, if you're not feeling great, then find someone you could work with that's going to continue to help you look for other root causes and what other things might be at play.
Mm-hmm. Yeah. And the cool thing about that is the other way my views have evolved is that in the past, I thought about this as something that was really more intractable and persistent longer term. But there's been so much data about most people that have their own thyroid still, and it's not shrunken away to nothing, that they can not only feel better, but a good percent of them can regain some or all their function back. So people can feel better. People can get their thyroid working better again. And I'm more, from what we've learned in these last several years, I feel more encouraged and optimistic about that than ever before.
That's so great to hear, because I think a lot of times when people get a thyroid diagnosis, they're told, well, you're going to have to be on thyroid medication for the rest of your life. You're going to have to go on it now, and you will be on this for the rest of your life. And I think it's really discouraging for people to hear that.
Part of it is that they feel like their bodies betrayed them, like they're dependent upon this thing. And what if they can't get it? And I totally get that. And part of it too is that when it came on, it's almost always the fact that they weren't feeling well and they pushed to get this diagnosed. So they've got this strong connection between this thing that affected their life and this disease. And so part of being told that you need to stay on this is almost hearing you're never going to feel better. You're always going to have this thing going on. So it's just the most awesome thing in the world to be able to take those toxic ideas and let someone be free of them.
Absolutely. And also autoimmune disease, any kind of autoimmune disease, but when we're talking about thyroid here, people are, when you're told you're immune system is attacking itself. Your body is attacking itself. You think, what's wrong with my body? Why is this happening to me? Right. So I think it's a similar idea that you don't, there are things you can do to balance your immune system.
Yeah, one brief point. So thyroid disease is by far the most common of all autoimmune. And the other encouraging note to let people think about with autoimmune disease, we now know that it's a normal, healthy process. So every part of the body, distinct part of the body, is a unique type of cells. So the thyroid is a big cluster of thyroid cells. And thyroid cells live 3-4 months and they break down and old ones get cleared out and new ones take their place. We now know that the old ones breaking down, part of that is done by the immune system. So there's a healthy immune process of breaking down those cells. We thought that a lot of it was done by other mechanisms before, but now we know it's the exact same way that can, when it's exaggerated, give rise to autoimmunity. So it's not some weird thing that happened. It's a normal thing that became excessive. And it can slow down again and you can be healthy. Yeah.
Yeah. And I think that is such an encouraging thing to hear from you. I mean, I think it's important to hear because people are oftentimes told that you're going to have this forever. You're going to another thing, like it's just going to struggle. And I swear, I think in medical school, doctors need to be taught more empathy. When you say this is what could happen in a patient's mind and what can happen to the body and the healing process when you say these things.
So case in point, this makes me nuts. The most common version of hyperthyroidism, we've talked about the thyroid being slow, right? So it gets overactive. The most common version of hyperthyroid disease was first discovered in Europe by Dr. von Badsow. And most parts of the world, we call it von Badsow's disease. Well, there was an Irish doctor named Dr. Grave who found it about the same time. So we call it Graves' disease here. Is that like the worst name? I mean, all due respect to Dr. Grave, but I mean, come on, that's not going to make somebody feel good to be told that.
No. Definitely not. Definitely not. So I know we talked about pregnancy and how that can be a phase of life that changes our thyroid, but perimenopause and menopause is another big change in a woman's life where the thyroid could change. Why is that?
Yeah, two big things. So one comes back to the estrogen fluctuating. So with pregnancy, there's just a lot of it there. And you have to like figure out how to, let's say you want to row your boat at 5 miles an hour and suddenly now you're going in a river of molasses. Well, if you can row hard enough, you could keep up and it might be okay. Well, imagine that the river is, got occasional waves of molasses, but they're not always there. So that's perimenopause. The hormone levels change a lot. And so the amount of resistance to thyroid hormone is in a radical state of flux. So the body not only has to be able to overcompensate, but then it has to like go back to normal again very quickly. So that's the difficulty. So that's one big driver. The other one is that thyroid disease is something that's going wrong for a long period of time and finally crosses a threshold. And that's why it's more common with age. The current stats are that even the most overt versions of thyroid disease, if a woman lives a normal lifespan, she's got about a 25 to 30% chance of getting the obvious versions of that. Each decade, the odds get higher. So part of it is that those hormonal changes make it harder, but part of it is also that these little glitches have now had, 4 or 5 decades combined in which they're more apt to start creating some problems.
Yeah, well, that makes sense. That definitely makes sense. And so certainly, the aging process changes with the hormone. And so is there anything, does it present differently in women do symptoms present differently?
Well, not always differently, but the difficulty is that those are symptoms that are just endemic to that time of life for other reasons. And that goes back to those secondary conditions, also things that we would chalk up to age. A lot of folks get tired for reasons that are just meaningless, that are just, they're just doing too much, So that can mask quite a bit of it. And then also just that radical change of hormone balance, it by itself can be a big deal. It can cause many other issues. So there's just a lot of different moving parts right at that time. It can make it hard to see how one thing is such a big driver.
Okay. Well, and one of the big things that we've talked about in the docu-series is about toxin exposure and endocrine disrupting chemicals. and how those can create issues and complexities with thyroid, well, all hormones, including thyroid. I wonder if as we age, because of we're getting exposed to more toxins over time, maybe they're accumulating more in the body. Do you think maybe that has a role to play in that?
It does. And what we see there, let me back up a second. I talked about how these thyroid hormones are proteins plus iodine. So iodine's an antiseptic, it like kills bugs, it kills germs, which is why you used to put it on skin infections back when. They quit doing that because we absorb too much of it. But it's a strong source of free radicals, kind of like bleach. And so you need some to make those hormones, but a little speck extra bleaches, it oxidizes, it damages thyroid cells, and it eventually recruits the immune cells to start attacking. So the body has ways of getting rid of that excess, and those are called deiodinase enzymes. And like a lot of things in the body, something that's used in one way is used for other things as well. So many of our detox pathways overlap with these iodine eliminating processes. So yeah, if your body has a fair amount of fluoride or mercury or BPA that you're carrying around, you can't regulate iodine as well. And you get to where that little excess builds up, causes harm, and can't get out. So yeah, all things thyroid always come back to iodine, but environmental toxins can be one more thing making someone less tolerant of it.
Okay, well, thank you. I wanted to make sure we touched on that because in the docuseries, we talk about the importance of reducing these endocrine disrupting chemicals in your environment, in your air, water, food, personal care products in your home, all the different ways we're exposed to them, to reduce your exposure, and then ways that you can eliminate them from the body. I would want to kind of go back to, we were talking about an example of a patient coming in to see you that has low thyroid function. She's got the autoimmune component as well. Talk to us more about how you approached a patient and what it's like seeing a patient, kind of the patient journey of what they would someone would expect.
Yeah, so most that come to see my doctors are already on medication. Whether they're necessary or not, they're pretty typically already on medication, and they're trying to get that dialed in and better regulated. So the first thing is really just looking at their original diagnosis. Ideally, we can look at their labs that started the whole process and just see if they were ones to where this is something they really do need longer term. And if not, then the discussion is, would you rather be on less medication? And it's easy to think through how potent their pill is relative to what their body's requirements are. And from that, you can say, oh, how much is your thyroid working right now by itself? And if it's a lot, it's not a big deal to let go of the pills. If it's almost none, that might not be the first priority. If the thyroid's barely doing 10% of what you need and it's all the rest of medication, that may be a lower priority step. But most are somewhere in the middle of that, to where the medicines are around a quarter. They're making about a quarter or so what their bodies require. So then it's a process of really just first off making sure their medications are appropriate and they're on a version that they tolerate well and that it's timed properly. Almost all the problems I find with levels not staying stable come from people never being told how to test their thyroid accurately. If you test it before your pill or after your pill, do you test it mid-cycle or the first week of your cycle? Do you test it in the morning or midday? Do you test it after your supplements? It totally changes it. Changes numbers by radical amounts. So the first step is just getting accurate baseline data, seeing what their output is. And typically the process of seeing someone's own function come back again, for an average person, that's 3 months, maybe 6 months. And those that never needed the medication by that point are on a very low stable dose, or they're just not on any. And then it's a matter of really seeing what are the other factors. And some of the other factors, there's no reason to delay that. They can be really well evaluated from the get-go. Parathyroid disease is quite common. And by quite common, those with thyroid disease, probably about 6% have either early signs of it or overt versions of that. And for many people, they're completely struggling with IBS, anxiety, fatigue, muscle cramps. They've got all these issues or some of those issues, and nothing else will touch it until their parathyroid function's made sense out of. That's one of the 15. So seeing what these other conditions are, getting the body healthier again and letting it regulate. Most people after 6 months or so, they can be stable on just some basic thyroid specific micronutrients and maybe a small dose of medication, maybe not any. And really turn the whole cycle. It rarely takes much longer than that.
Yeah. Yeah. Amazing. So, I think that's great. And with parathyroid, just so people understand, like, what are you looking at for that, and how would they know if that might be an issue for them?
Yeah, so the parathyroid glands, para means next to, they're neighbors of the thyroid. They've got some things they overlap with in terms of function, but in most cases, they do different jobs. They just happen to be neighbors. They regulate calcium absorption into the bloodstream. Calcium's in the bones, in the gut lining, in the bloodstream, these various compartments. How much is in your blood is life or death, so regardless of whether you had milk yesterday, your body has to keep just the exact right amount in your bloodstream. So when that's not right, it's almost never a function of, consuming too much calcium, too little calcium. It means it's not being properly regulated. And the most common issue is that there's usually four, most commonly one of these four goes berserk, and it puts out too much parathyroid hormone, and it pulls in too much calcium. And if it's bad enough, calcium's way above range, it's rather obvious. But I see so many cases, even then, where calcium's above range, and doctors are like, oh, no big deal, we'll ignore that, we'll check again, that comes and goes. I'm like, well, it's a big deal. It's not only a huge source of symptoms, but it's a huge source of cardiac disease risks and other problems. But the big wrinkle is that among parathyroid specialists, what I'm about to say, there's no controversy whatsoever. So within the normal level of blood calcium, most labs say you're normal up to about like 10.5 or 10.9. But if you're above 9.8, that's suspicious. And you can be completely normal, but things aren't working right. And that's because your parathyroid hormones should lower when calcium's high normal. And some people don't. So they could have normal amounts of parathyroid hormone and normal amounts of calcium, but they can have a problem if they're both on the higher side of normal. The parathyroid should dip to make room. So yeah, there's a big chunk of people to where both of those numbers are completely fine, but they've got an overt disease present.
Interesting. Yeah. It's, yeah. I mean, it's, there's so much interconnected intricacies of our bodies and how our hormone glands, our endocrine glands work together. And I think a lot of times people forget about that. And you also talk a lot about adrenals and how those, I know you've got a book on adrenals, and at least one. I've lost track, Alan. You've got so many. But can you explain a little bit about how adrenals play into thyroid?
You're talking about so many good, important factors about health, and along with all these things, we're all trying to live our lives and trying to manage relationship and a changing world and financial stressors and whatever else goes on, and so our body has these stress response pathways, and they can, if we have big traumas early in life, if we have persistent traumas later in life, if we have cumulative traumas, our stress response becomes trigger happy. And we very readily go into a fight or flight state, and we have a hard time getting out of it. And the data about that kind of response affecting our health is just overwhelming. When we're in a state of chronic heightened stress, nothing works as well. We're more apt to have autoimmune disease start. Our body can't respond effectively to thyroid hormones. We can't buffer the changes of perimenopause. We can't really repair the things that are just latent issues that shouldn't be a big deal to fix. So yeah, this is a huge thing. And the word stress is one to where, I don't know, it's probably one of the more relevant buckets, but I don't like it because we're so used to just like thinking that it's something that's bad, but we have no control over. We can't change all the difficult circumstances we face. We can't make life be effortless, and of course not. But the adrenal glands govern a lot of things. They govern our circadian rhythms, how we regulate our blood sugar, our light exposure affects them. So even though we can't make life effortless and smooth, we can do some basic stuff to make our bodies more resilient and not just get like mowed down by all of it.
Yeah, absolutely. And when we do that, when we set ourselves up for a good night's sleep, when we do stress management, a lot of things that we talk about in the docuseries and helping reset our circadian rhythm and those sorts of things, it helps our adrenals, but then it also helps our thyroid, right?
Mm-hmm. Yeah, we're less apt to develop autoimmune disease. We're more able, all the hormones, as important as they are, a big thing that I often hear missed is that they're all buffered. The glands never make exactly what we need. But when we're healthy, we've got a million ways to take what we can get and do well with it, but not so much when cortisol's off. So yeah, the more stable our adrenal function is, the more we can buffer all the rest. Even if the rest of it's not perfect, we can it's close enough. I'm going to put that over here. We can do that.
Yeah, perfect. I know we've spent a lot of time today talking more about low thyroid function, but certainly all of this applies. Even if you have hyperthyroid, a lot of this applies as well. But is there anything specific about treating or addressing hyperthyroidism? I know you mentioned it's oftentimes Graves' disease, but is there anything in particular you'd suggest for people who have that?
It's quite common as well. And if you look at certain demographics, certain age groups, it's more common than hypo. So it's not that rare of a thing. In terms of things to address it, low thyroid for many, many people, just doing nothing other than regulating iodine can reverse it or radically improve it. With hyperthyroidism, what happens is that too much thyroid hormone is generally caused by an autoimmune response as well. With hypothyroid, the autoimmunity breaks down the thyroid and it just can't make enough hormone, kind of simple. With Graves' disease, think about like a doorbell. So there's a button outside the thyroid that tells it to work. You hit the button, the thyroid's like, oh, here you go, here's some hormone, right? So with Graves' disease, there's a short circuit on that doorbell. Nobody's pressing the doorbell, but your thyroid thinks it's being told to work. So yeah, the immune system falsely mimics the brain's signal telling the thyroid to release hormone. So the thyroid's healthy, but it's just overstimulated. And your body is actually trying to slow it, your brain is trying to slow it down. But these errant immune cells are activating it. And once that gets to a certain threshold, it becomes this self-perpetuating cycle. The higher amount of thyroid hormone causes a lot of stress on the body in ways that worsens the autoimmunity. So yeah, once it gets going, it feeds off of itself and makes this positive feedback cycle. So it almost always does take some means to initially slow the gland down. There's medications, there's some cases where natural compounds can do that. Once the gland has slowed down, then all treatments come back to iodine regulation. And that's true in the conventional world as well. All the medicines that slow the thyroid, they do so by slowing its absorption of iodine. And so once you've got it to where it's already in the ballpark, if you can just put less gas on the fire, it can reverse itself. So hyperthyroidism caused by Graves' disease, it can be life-threatening in the moment. I can never downplay how bad hypothyroidism can be, but it's rarely lethal in the short term, whereas hyper can be. Yet the odd paradox is that for about 95% of people with Graves' disease, if they can safely stabilize their levels and keep them there, they've got about a 80 to 90% chance of full disease reversal within 18 to 24 months. So if it's kept in check, it can get better. And the rate of full-time cure in the conventional world is much, much higher. So yes, it can do well, but it also comes back to iodine regulation.
Yeah. And so people don't have to take medication for the rest of their life?
No, almost never. Yeah, there's medicines that can slow it down a lot, but if it's kept in a good range, the whole process does calm itself down for most people. Other common treatments can involve radioactive ablation to destroy the gland or surgery to remove it. And there are some circumstances in which they must be considered, but for most people, they're not necessary.
Yeah, I know. I think that a lot in the past, a lot of doctors were quick to do those surgeries, really quick to do them, because I think maybe the medications they didn't have those dialed in as well. But like, I know that my grandmother had it done because that was the only option, right? So it's nice that we have, women and men both, we have more options now.
Yep, that's gotten better as well.
Yeah. And as far as natural substances that do help with hyperthyroidism, are there any particular ones that you like?
All the ones that work do require prescription strength potencies. So kind of a bizarre thing. One of the things that is most effective is, not recommended, but has been shown to be quite effective is megadose iodine. So the paradox is that high amounts of iodine shut down the thyroid. So because the body needs some, a lot makes it just shut itself off. The drawback, of course, is that the extra amounts may trigger even erratic amounts of huge releases of hormone. So it's not a recommended therapy, but yeah, iodine can actually slow it, and that's been studied. The other two are related to iodine, and that's fluoride and lithium. So those are two minerals that are used in a variety of ways, and they're things that can be toxic. They're things that can have toxic side effects. But both of them, their main early toxic side effect is they inhibit the absorption of iodine in the thyroid. So their earliest toxicity is hypothyroidism. So yeah, in the hands of doctors that can use them in prescription strength forms effectively, they can be safely used to slow the thyroid, and they can be given in doses that are low enough to not cause other issues. And for some people, they can be better tolerated than medications like methimazole or propylthiouracil.
Great. All right. Well, Alan, this has been absolutely fantastic. We've covered a lot. Are there any last minute words that you'd like to share with the women watching this? Any kind of last bits of wisdom?
The big picture is you're doing the right thing by tuning in. Check out all the interviews. Be sure you can maintain access to this as long as possible in some way so you can really go through all this thoroughly. But please know that your ability to make decisions and vote with your fork and vote with your running shoes, whatever it is, your control over your health is so much bigger than you would think. This has been my whole life's thing, and I keep realizing, wow, this is bigger than I thought. So you can do a lot, and if you're stuck in some way not feeling well, don't think it has to be like that. You can find some of the other speakers events on this docuseries. You can find some of the bonus interviews. You can find answers, and there's ways you can really get out of that. So please know that you've got the control over all this.
Yeah, thank you so much, Alan Christianson, Dr. Alan Christianson. And you're to just tell everybody the name of your website, where they can find you on social media.
Yeah, drdrchristianson.com is the website, and at drchristianson, all the social media handles. So yeah.
Awesome. Thank you, Alan.